Okay, today we are talking AKI, or acute kidney injury, formerly known as ARF, or acute renal failure. The easiest way to think about acute kidney injury is happening before the kidney, or pre-renal, something happening within the kidney itself, also known as intrinsic or intrarenal, or something backing up after the kidney, which is post-renal. So let's talk about the pre-renal first. Pre-renal is basically anything that decreases perfusion to the kidney. So here we blow up a nephron, which is one of the functioning units of the kidney, of which we have 1,000,000 of at birth, and of course it decreases with age and with damage and whatnot. Now this is a close-up here. Now what you notice is the afferent arteriole going in and through this whole glomerulus, and the efferent arteriole going out. So afferent, you can remember this by A before E, right? So A goes in, E goes out. Now, basically, notice this. The afferent arteriole is bigger than the efferent arteriole. This is ideal because think about it like a hose, right? If you have a great flow of the hose in and you pinch out the exit, what happens is you build up pressure within the system so it filters better. So the GFR is good. Anything that affects this, which we'll talk about shortly, of course, will then decrease the filtration rate. Now, first of all, think about what if there's just less flow of blood in. There's just volume depletion. Now this can happen, of course, with dehydration. It can happen with GI fluid losses, like you're vomiting, you're having diarrhea, so you lose fluid that way. Hemorrhaging is obvious, as well as burns. Burns, you lose a lot of fluids from the burns, and so you just have lower volume. So that would be a problem. You see less blood volume going in, of course you're going to have less blood filtered, hence you'll have a lower GFR. You can also have decreased output from the heart to pump. So your pump right through the pipes is not working very well. So this can happen with heart failure. And heart failure can be caused by various things, including a heart attack. And so the tissue is not pumping well. So basically you see less effective blood volume going into the glomerulus. Another thing that can happen, you can get systemic vasodilation. Basically, you're just having your blood vessels just enlarge everywhere, so then there's, again, more blood to pump to. It's almost like your hose suddenly got bigger, and now your pressure just in the whole system drops, right? And so basically, the kidneys will see effectively less blood volume again, and that can happen with sepsis, that can happen with cirrhosis, anaphylaxis, things like that. Okay, so that's just the blood flow volume in. Okay, so now let's talk about things that can affect the afferent arteriole, things that go in. Now what happens if you narrow this? Now of course, if you narrow this, what happens is you're going to, again, the kidney or this glomerulus is going to see less blood flow overall. So your GFR, or your filtration rate, is actually going to go down. So what are some things that can decrease the cause vasoconstriction of the afferent arteriole? Well, one of the most famous ones would be NSAIDs. NSAIDs, anti-inflammatories, will decrease the afferent arteriole diameter and basically decrease effective blood flow. So long term, this could be a bad thing. There's also other medications like calcineurin inhibitors, some contrast agents. That's one of the ways they would damage the kidney. And so again, less blood flow in because of vasoconstriction of the afferent arteriole. Contrastly, what if you suddenly let out the pressure on the back end? Well, okay, well then just it flows faster and doesn't get filtered as well, right? Basically, there's less back pressure. And what can do that? Well, things like ACE inhibitors, ARBs, renin inhibitors, anything that affects the RAS system, the renin-angiotensin system, aldosterone system. So basically, that would cause you'll see a decrease in GFR. Now with the ACE inhibitors and ARBs and whatnot, there is a compensatory mechanism, and it's actually not causing long-term kidney damage unless you're already volume depleted, right? So if this is already low coming in and then this is huge coming out, again, there's almost no pressure gradient enough to cause good adequate filtration. So that is all the major that is all the pre-renal causes that can cause acute kidney damage, or AKI, acute kidney injury.